Hi, everyone. My name is Liz Monroe, and I am the Director of Marketing at the Flutie Foundation. Welcome to everyone who's tuning in on Facebook, YouTube, and LinkedIn Live. We're so excited to be here tonight at Bubble Dentistry in Newton, Massachusetts. Just check out this office, this incredible backdrop. This is all real. This is their offices in Newton. We're really excited to be here for our Ask a Dentist Q&A with Bubble Dentistry. While there are many choices for dentists, it takes a certain level of training, experience, and compassion to specialize your work for the specific needs of children and adults with autism. Tonight, we are going to hear from two parents with children who are patients at Bubble Dentistry about their experiences with the inclusive dental practice, Bubble Dentistry. So, everyone tuning in, this is an interactive live show. So make sure you ask questions during the live. We will try to get to all the questions, and if we don't, we will answer them in the comments later on. You can ask questions to Dr. Josh from Bubble Dentistry, who you'll meet in a second, and to Stefano Micali, our live EMC, who I will introduce in just 2 seconds. So you can ask anyone questions, and we will answer them. So without further ado, I'm pleased to introduce our musical host for the evening. You may remember him from our Rock and Raise for Autism Gala and his musical productions. So everyone, please welcome Stefano Micali. Give some applause.
I live for the applause, applause, applause. Live for the applause, live for the applause, live for the way that you cheer and scream for me. The applause, applause, applause. Thank you all for tuning in, and thank you to Bubble Dentistry for allowing us to film in your office. I am 26 years old, and I am pleased to be your musical MC and host for tonight's show. I am from Boston, Massachusetts, and I work at LaSalle Village and the Boston Duck Tours. It's my goal to be a narrator at the Boston Duck Tours and become a chef who gives hands-on experience cooking food with fats that do not have bad cholesterol and with no sugar. I am excited to be here with Dr. Josh Hurlburt. Dr. Josh is a pediatric dentist here at Bubble Dentistry who is committed to having each and every child, including those with autism, have a positive interaction while visiting the dentist. Please welcome Dr. Josh.
Hi, everyone. Thank you so much for having me, and thank you for coming to my office tonight.
Josh, can you tell us a little bit about yourself and your role at Bubble?
Yeah, so my name is Dr. Josh Hurlburt, and I'm originally from Michigan, and that's where I did most of my training. And then a while back, I was able to finally move out here to the East Coast and finish my residency at Boston University. And I just have absolutely fallen in love with the East Coast and Boston, and I cannot leave. And I'm so lucky to be working here at Bubble, and I'm so honored to be working with the patients that come into my office every single day. And I'm a pediatric dentist here, if I didn't say that already.
Very good. Dr. Josh, what's your favorite part about being a dentist?
You know, that is such a hard question to answer. And I've really thought about this over the years. And I honestly think my favorite part about being a dentist is the education part. I love being able to talk to my patients. I love being able to talk to the parents of my patients and get to share some of the knowledge that I know with them. I went to school for a long time. I got to specialize in pediatrics, and I just love to share my knowledge and have those conversations. And also, I'm a very conservative dentist, and I like to focus a lot on prevention. And with prevention is education. So I like to fix the problems before they're even there, and I like to think that education is a great part about doing that.
Understandably so. So what does a typical day look like for you?
You know, a typical day at Bubble always includes me walking in with a smile on my face. And honestly, every single day is different. Every single child is different. Every single family, every single parent is different. And I really strive to just focus on having a great customized experience for those patients. And that looks different for every single person. Sometimes it's being really, really friendly with them, making jokes. Sometimes it's me just coming in saying, hi, I'm Dr. Josh. I'm just going to look at your teeth, and that's that. And then the next time they come back, it's different. So honestly, every single day is a different day here. And that's what makes my job super, super fun and awesome.
I agree. It's very awesome. What is one thing you want people and families with autism watching this live right now to know about Bubble Dentistry and or going to the dentist?
Well, first, I would just want all parents and families to know that Bubble Dentistry was created with patients that have autism and other special needs and other special healthcare needs in mind. We want this to be a really warm, fun, exciting, and safe place that both parents and, more importantly, the patients and the kids feel comfortable going to. We kind of joke and say, you know, this is like a destination dentistry. We really want kids to be excited to be coming here. And we will work with families on kind of customizing things. So I have many families that will tell me before they even walk into the office what their kid likes, what their kid doesn't like, and I can really change my approach and the appointment for them. So my point is just know that we are adaptable. I'm happy to take any suggestions that families have, and I will really make it a customized experience for you.
Wow, making everything appreciative.
Yeah, I mean, first and foremost, I'm appreciative and honored that I even get to treat these patients and get to work with all these children and all their families, because it's truly rewarding from my end. But it also makes me incredibly sad to hear these stories about how other dentists don't want to see these patients, and I just can't get enough of seeing these patients, and I absolutely love seeing these patients. I love going home, and that's what makes me happy, is being able to treat all these patients and making sure that they feel comfortable. And yeah,
of course. Thanks, Dr. Josh. We are excited to have your expertise with us today. Viewers, don't forget to write your questions in the chat so Dr. Josh or the parents can answer them during the show. Now, I'd like to introduce our first parent speaker, Sarah. Sarah, can you introduce yourself and tell us about your family?
Sure, of course. My name is Sarah. I live on Cape Cod with my husband, John, and our 7-year-old son, Tanner, who has autism.
How has your experience been bringing your child to Bubble Dentistry?
I can't even begin to explain what a wonderful experience we had. I first saw Bubble Dentistry featured on, I think it was back in January, on a webinar that the Flutie Foundation did, and I called the next day. We had just had our my son's dentist appointment, I think a week before. So I called the next day and was able to get him in for his next appointment. We came in August, and you know, sometimes children with autism, there's a lot of anxiety that goes along with doctor's appointments, dental visits, and on my end as a parent, there's a lot of preparation that usually has to go into it. So it was really nice. We went on the website together. We were able to see a virtual tour of the office, which is such a big thing for a child with a lot of anxiety, to know what they're walking into before they get there. So that was a really great thing for us. And it's as though Bubble Dentistry was built for my son. He's loves marine life. So when we got there, he thought he was at the aquarium, and all of these past experiences that we've had at the dentist sort of went away, and he was super excited to be there. As soon as we walked through the door, we were greeted so warmly. We were given a tour, so my son got to see everything before we were kind of even seated. It was a really great, welcoming experience that I don't think you get at a lot of places. And I think that Bubble Dentistry truly understands what is helpful, not only for our kids, but for us as parents. So it was a really great experience. From the moment we sat down, our dental hygienist was awesome. She let my son put the gloves on so he knew what they felt like before she was using them to really help with those sensory differences. And I can't say enough about Dr. Josh. He did a wonderful job with my son. He was very patient with him, talked him through everything. And I was really, really happy he spent some time with me afterwards. My son got to go feed the fish, and I got some time to talk with Dr. Josh about preventative care, and even discussed ABA with me and things that, you know, we can talk to the ABA therapist about. So that education piece, as he spoke to earlier, was really wonderful, because we usually don't have that time, or I hadn't had that time with dentists and prior appointments to really get kind of all of that great information. So we really, really, I can't speak highly enough about this practice. And we drove over an hour to get there, and it's, we'll do it again every time. So I wish there were more pediatric dentistries like this, because I think there's such a big need. And I think it's really important that families understand that they're here and they will help. I think I might have lost audio. I'm sorry if you're asking me a question. I can't hear you.
Lastly, what do you want other parents to know about going to the dentist?
I think that they can know that it can be a great experience. It doesn't have to be something anxiety inducing or something that, you just kind of go through the motions when you get there. I think it can be a really wonderful experience. And my son is super excited to come back, which, just kind of exceeded my expectations. We were hoping to get through a dentist appointment, and now he wants to come back. He wants to come back to the aquarium. So I think that speaks for itself as far as where we were and where we are right now. So we're super appreciative.
Of course, that sounds great. I bet your son even likes to go to the New England Aquarium too.
Yes, he sure does. He sure does. It was nice to have this more controlled environment, though, for him to be in with all the fish.
You should know, too, that I can actually sound the African penguin very perfectly.
Can you?
Like this.
That's very impressive.
That's impressive.
Thank you. Thanks, Sarah, for sharing your insight.
Of course. Thank you for having me.
We appreciate everyone who has asked questions so far. Dr. Josh, please join me to answer a few questions for our audience. We got a question about getting braces for people with autism in Invisalign.
So I can talk a little bit about that. I was going to mention this later. This is what kind of makes Bubble Dentistry a little bit unique with helping any patients, but also patients with autism, get braces and Invisalign. So first and foremost, I just want to put a little plug in for my colleague, Dr. Swami. She's our in-house orthodontist. She unfortunately wasn't able to make it here today. However, she is brilliant, absolutely wonderful and lovely in every single way. She has 10 years of experience. And most of those years includes working with patients with autism. So I like to think of myself as extremely patient, warm, and welcoming, but she is another level. She is very, very nice, very, very great, and amazing with those patients with autism. And so she has that wonderful expertise coming into this practice. But also, we offer a lot of other great things here at Bubble Dentistry that some other offices might not offer. So to start, we invest in new technologies. So instead of going to the dentist and getting the goop or getting the kind of gel stuff where we used to have to push in the impressions in and out of your mouth and then you gag and it's just not a really great experience, we don't actually use that anymore. We actually use a computer software where it scans your entire mouth, and then that helps Dr. Swami and the orthodontist place the brackets or use Invisalign. So that's like a very easy thing, an easy switch that we do while also staying alive with the 21st century in the technology world. And then also something else that Dr. Swami is starting to do a lot of is a different technique of braces that she's able to cut her appointments down by like 2/3. So what normally would have taken 90 minutes might take 20 to 30 minutes now, just because of the new technologies. She's able to place all the brackets on in about 20 minutes, half hour or so, and that cuts the time down a lot. Even those appointments can be cut in half or so. So that's one of the ways that Bubble Dentistry tries to make it easier and more user-friendly to come for braces and Invisalign as well.
Amazing. When was that invented?
I do not know that question, but I imagine probably within the last few years because it is so new and it's so innovative. So if I had to guess, probably within the last 5 years or so that it became on the market.
Who is the shark behind you?
Oh, okay. This is our Clark the Shark. He has a little joke over here. It's right behind Stefano. We change it out every few days, and Clark the Shark gets to hang out with us, and he sits out in the front of our office every single day near the road. So everyone driving by in Newton Center gets to see our office while also getting to say hi to Clark the Shark.
In that case, I'll read the joke.
Okay, please do.
Oh, wait.
What do you call a bee in America?
What do you call him?
A USB.
See, I think that's a very clever joke and a very dad joke, but here I am still loving it.
Son is free on Friday. Question for Dr. Josh. Son is free on Friday. Doesn't understand simple directions. Worried about his health of his teeth, but not sure the right time to bring him in.
I would say it's never too young to bring your child in, regardless of if they have autism or not. So I really love to see kids by age 1, regardless of health. I really think that that's a very, like I said, I like to focus on the education part. So by age 1, I get to talk with parents and be like, all right, this is a new child. Here are some tips and tricks that you can use moving forward to keep your child having immaculate oral health. Now, this question is, her son's almost 3 years old. And when would be a good time to come in? Because he may be scared, he doesn't listen, he doesn't know how to follow commands. I think now is still a great time because I even say, let's say you come in, your child is not able to cooperate very well, he's scared, he or she is scared, this is a new place, they don't know what's going on. We're very open to just walking around and getting a tour for your first visit, just showing what the office is, showing them the chair, showing them the water sprayer, the air sprayer, just showing them what's around. We don't actually have to do anything that first visit. It could just be getting used to it, getting accustomed. We kind of call those desensitization visits, where just getting used to the environment, you get to see it's a really fun, safe, and warm place. So we're very okay, and we actually do that quite a bit, where just parents and their kids will just come in, walk around, get to meet me, but we don't actually do anything. And that's a very, very successful first visit. And then normally second visit, we just get to look at the mouth. I just use my hands. I don't use any instruments. It's just getting used to somebody with gloves, some sort of authority figure, somebody you don't know, wearing gloves, looking in your mouth, just getting them used to that very, very simple thing. Even if they're not listening, even if they're not opening, there's still so much I can see in seconds. So I would say bring him in anyways, and we will work with you. We will work with your son to figure out what's best for him. If he needs to just walk around and get used to the office and that's the first visit, that's great, that's wonderful, and we'll leave it at that. And then you guys can come back next week. You guys can come back in a couple months. It's really up to you guys what works well for you. And then we do an easy visit. I'm never going to push kids too far. I'm never going to push any of my patients too far where they don't want to come back. That's absolutely the last thing I want to do. I want them to get used to coming to the dentist and seeing that, you know what, it's not such a bad place here.
Yeah.
Awesome. Thank you. Awesome job, you guys. So I'm just going to jump in here, and Stefano's going to make his way over to do another musical interlude. But while he's making his way over to the keyboard, I just want to thank you all for tuning in tonight. And don't forget, this is a live Q&A. So if you have any questions for Dr. Josh, Stefano, or Sarah, make sure you leave them in the comments, and we will do our best to answer all your questions. Okay, Stefano, hit it. Awesome.
That was great. Thank you so much.
Just like the song I just performed, the staff at Bubble Dentistry will make you jump for joy after meeting them.
Okay, we got a question here, so I'm just going to pop in. This is a question for Stefano. Stefano, do you go to the dentist, and what's your favorite part or one thing you want to share about going?
One thing is that since I really take good care of my teeth, my dentist compliments me on it.
Good, that's great. I love giving compliments all day long when I can.
What kind of technology do you have to help make the appointment go smoothly?
Well, I just want to reiterate the computer scanner that we have, the iTero. That's a very new, innovative thing, and that's something that makes the appointment go really smoothly, because even though on the orthodontist side, we're using it more for braces, when I use it, it's really, really cool because I get this big computer screen, and you actually get to see all your teeth. And let's say there are cavities, or let's say I'm concerned about something else, I can blow it up and you get to see your tooth. So that makes the appointment really, really smooth, fun, and exciting for the kids. And then some other technologies that we have here compared to some other offices is we just offer some more, like we offer the laughing gas, the nitrous, or the general anesthesia. Those are just options that we have here, more advanced technology, more advanced medical procedures that we do here. And those are things that I'm happy to have conversations with parents about if they want to know.
So, of course, but I don't have any kids.
Oh, this is a question someone asked.
Oh, I see, sorry. So, what is one piece of dental advice parents and families with autism can leave here with?
You know, so one piece of advice I can say is don't be scared to come, all right? No matter what age your child is, no matter what experiences you've had in the past with other dental offices, just know that here at Bubble, we're going to strive to be different. We're going to strive to be unique, and we're going to strive to make sure that you and your family have a great experience here. We won't give up on you. We aren't going to send you out the door. That absolutely is not what we're going to do. We are here for you, so please do not be scared to come. Please do not be hesitant. Just come, see what we're about. We can do super, super easy visits the first time. And I'm sure once you're here, you're going to realize that this is a really great place and you're going to want to keep bringing your kids back here.
Sounds great. Thank you.
Yeah, you're welcome. And I think we have one more question, if I'm right. And it looks like it's something about my child hasn't been to the dentist for years, and I'm sure that he needs a lot of work. Can we use sedation at the appointment? And then, I kind of alluded to this earlier. Absolutely, we can. And it's part of what makes Bubble, where we are able to customize the experience for you. So really, that first visit, I really like to just get to know you guys as a family. I like to get to know your child and figuring out what's going on. I like the first visit to be super, super easy, relaxing. We're not going to be doing any dental work usually the first visit, unless there's some sort of emergency going on. And then during that visit, I can we offer two main different types of sedation here, and that is the laughing gas nitrous or the general anesthesia. And I'm happy to answer any and all questions that parents have about that at the appointment, just because it truly is different for every single child. But yeah, push comes to shove, yes, absolutely, we can do sedation at the appointment. We can even do sedation if, just to do the regular exams and regular cleanings as well, if that's something that's needed. But I really want you to think of the first visit as just coming, getting to know us, and then at that visit, we can talk more in depth about different sedation options, different treatment options, and know that there are options. There's always going to be a backup plan for me in my head.
Awesome. Now, that was a fun Q&A session. Before we say goodbye, we're going to give you a tour of Bubble Dentistry. Dr. Josh, please lead the way.
Yes, all right, come follow me. Let's start with this side over here.
Okay. Following you.
All right, so here at Bubble Dentistry, we have 21 chairs. So there's tons and tons of space, and we can see tons and tons of patients here. So this side over here is mostly where I do all my exams, all my cleanings. We have 8 chairs over here, and we have a 10-foot aquarium right over here too. And we actually have 2 big aquariums here, and this is such an easy distraction for the kids. A lot of times I have them sitting right up. I'm doing my exam while they get to look at the fish over here. So it's really, really awesome and amazing. And if you can't tell, this office is super, super clean, super sterile, but yet it still feels super fun. It doesn't feel like you're just in a medical office. So we have this beautiful wavy aquarium, so we can kind of walk around that. We have everything in that aquarium is real. We have this big rock structure. And then something that I always forget about is let's look up. We have all these things hanging from the ceiling, all these sea creatures. We have the jellyfish, the dolphins, the stingrays, the fish, and the turtles. It's all really, really great. And then once we keep walking back here, I'll keep showing you some more of the office. There's just so much to show, and I get so excited that if I'm losing you guys, please keep trying to follow me. So they're both about the same side. On the one side versus the other, there's a bunch of chairs. We have these beautiful wallpapers. And in the back, real quick, we're going to go just so I can show you where our private rooms are. Because some people, because of COVID and because of many other reasons, like private rooms. So we do offer private rooms, not just the open bay. So this is kind of our private suite area. And this is one of our rooms. And it still follows the whole aquarium theme and everything. If we look at the wall, we have these beautiful wallpaper where it still feels like you're underwater and in the aquarium. So we do offer some private rooms too. And if that's something you guys want, please just let us know beforehand and we're happy to accommodate. And let's go way up to the front right when you guys walk in. There's so much cool stuff up here too. And like I said, every time I walk through here, I'm still at absolute awe because there's just so much going on here. There's over 100 things hanging from the ceiling. And this is our front lobby. This is where you guys get to walk in. It's so awesome. We have this kind of Atlantis-like feeling with the gate and everything. It's super, super awesome. And then right over here is my favorite area. This is the octopus cave with the games. My favorite game is is bowling. And yeah, so super, super awesome. We have the octopus cave. Lots of kids like to play here. We even have things for the little ones right over here where they can spin things around and they just get to have a really good time. So while they're waiting for the dentist, they're not even scared. They're just like, I'm just playing here at the arcade. So it's really, really awesome. So, all right. And then let's go right up here. This is the part that I feel like everyone always misses. So it's my little secret to you guys. Don't miss it when you come visit. We have this beautiful jellyfish place, all right? There's very few places. These are real jellyfish. There's very few places in New England that actually have jellyfish, and we're one of them. And I feel like people always miss it, so please don't miss it. It's so, so cool. All right.
Great. So we'll head back for Stefano's finale song.
Absolutely.
Oh, and we gotta pose for the seals.
Yes, I completely forgot that we have Frank and George here. They're our harbor seals. And eventually, I think we're going to get a little selfie sign here because this is the best place to take pictures in the office. So when you guys come visit, please take a picture here so you guys can remember the great memories and having a great experience at Bubble.
Love it. Okay, Stefano, you want to play us out with applause?
Yes, please.
Okay.
Let me try again. Okay, hang on a second. And live for the applause, applause, applause. Live for the applause, applause. Live for the applause, applause. Live for the way that you cheer and scream for me. The applause, applause, applause.
Great. Thank you everyone for tuning in. It was so nice to be here at Bubble Dentistry with Dr. Josh and Stefano. Thanks for a great tour and thank you for tuning in. We'll be back soon. Thanks.